In order for us to fully understand Obamacare, we first have to take a small trip down memory lane. Let me take you back to 2010. The FIFA World Cup was held in South Africa. Apple released the very first iPad, and US President Barack Obama signed the Patient Protection and Affordable Care Act into law. The Patient Protection and Affordable Care Act is significant because it was the largest reform to American healthcare since the introduction of Medicare and Medicaid by President Lyndon B. Johnson in 1965. Little fun fact, former President Harry S. Truman and his wife were the first to sign up for Medicare. The idea behind the Affordable Care Act was to get Americans insured. At the time, many Americans were either underinsured or not insured at all. Before the Affordable Care Act, it was difficult to get coverage because insurance providers could deny applicants due to their health status and previous yearly spending on health coverage. Plus, health coverage seekers faced hard-to-read coverage plans that were designed to be indecipherable. The Affordable Care Act set out to end this type of insurance practice. On October 1st, 2013, Healthcare.gov was born. Healthcare.gov was one of the first government-run online marketplaces and sought to provide the public with an easy-to-use platform where they could compare plans, shop around, and decide what coverage was right for them. This kind of information was not readily available prior to the Affordable Care Act and is still available today. You can sign up for a marketplace plan yourself, or you can contact an insurance agent, like the ones we have here at Empower, for help with your coverage options. Consultation is available to you at no cost and no obligation. So if you want to get connected with one of our friendly agents, our link is in the description below. Now let's get back into it. The Affordable Care Act required insurance companies to provide coverage for all applicants, regardless of any pre-existing conditions or prior non-eligibility. This is known as guaranteed issue. For example, prior to the Affordable Care Act, if you were diagnosed with breast cancer and you applied for health coverage, you could be automatically denied due to your pre-diagnosed condition. Or worse, you could be charged an extraordinary premium. Guaranteed issue policies granted relief to many Americans who could not get coverage otherwise. This, in turn, reduced the number of uninsured Americans from around 16% to around 10% within the first 5 years of implementation. The Affordable Care Act also aimed to assist low-income families through the expansion of Medicaid. Before, eligibility for Medicaid was limited. For instance, if you were an adult without a dependent, you could be denied coverage. After the Affordable Care Act, Medicaid expanded to increase eligibility for more Americans by reassessing the income threshold. This helped cover many low-income Americans who normally couldn't get coverage. This expansion didn't come easily, though. To offset the increased financial burden of healthcare, the Affordable Care Act required most individuals to maintain a minimum healthcare plan. If you failed to maintain that minimum level, you would incur a fee for not having health coverage under the Shared Responsibility Payment, or mandate. So, the option was to pay for minimum health coverage or pay a fine. This fine was collected during the tax season of the following year. The goal of the mandate was to evenly distribute the risk associated with health coverage. Without the mandate, individuals who decided they did not need insurance could opt out of the program entirely, leaving the full cost for those who did need coverage, further burdening the sick and impoverished. The only way to make this work was to collect fees on those who opted out to help reduce insurance premiums. Not everyone was required to sign up for plans, though. You would find yourself exempt from fines if you experienced a financial hardship, if healthcare violated your religious beliefs, or if you were a member of a recognized tribe. Hey, still with me? Did you get all of that? If not, don't worry. We're almost done, but first, let's do a brief recap. The Affordable Care Act was first passed into law in 2010. The ACA reduced uninsured Americans by over 5% within its first 5 years. It created a new online marketplace where people could shop around for their health coverage. Medicaid expansion helped low-income families get healthcare coverage through eligibility reforms. Shared Responsibility Payment required individuals to maintain a level of healthcare or pay a fee. Not too bad, right? If you're still following, let's get back into it. Only one more point to cover. Fast forward to today and things are looking a little different. The Tax Cut and Job Act of 2017 reduced the taxation of individuals without health coverage to $0. So, the fining of people without coverage ended in 2019. This change brought its own challenges. With the removal of the individual mandate, this sparked the question, was the Affordable Care Act constitutional? This was known as California v. Texas. The plaintiff questioned the constitutionality of the Affordable Care Act since there was no longer a tax penalty. The case was presented in front of the Supreme Court in 2020. The Supreme Court ruled the plaintiffs did not have standing to challenge the ACA's mandate, and the case was effectively dismissed. The Affordable Care Act has come a long way since its inception, and who knows what it may look like in years to come. What I can tell you is that the Affordable Care Act has definitely helped many Americans who could not get coverage find coverage. If you're not sure about your current insurance coverage or insurance needs, follow the link in the description and we can connect you with a friendly insurance agent. Our agents can assist you with any questions you have at no cost and no obligation. Don't wait until it's too late. Click the link in the description to get started. And as always, if you're interested in empowering yourself and taking control of your situation, subscribe to our channel and put more health, life, and financial tips on your radar. Thanks, everyone.